My name is Karen Tronsgaard-Scott, and I am from the Vermont Network Against Domestic and Sexual Violence. My role there is as its executive director. I want to thank everybody for being here this afternoon, taking the time out from your busy days to participate in this conversation. We're here today to announce the release of a new report entitled "The Economic Impact of Domestic and Sexual Violence on the State of Vermont." You know, we've long known that Vermont has a violence problem. Every day, Vermonters suffer the impact of domestic and sexual violence, leaving lasting trauma, interrupting lives, and limiting possibilities in families and communities. We understand the emotional, mental, physical costs of domestic and sexual violence, and today, for the first time, we can see the financial costs, not only to those directly impacted, but also to each and every Vermonter. For the first time ever, we've examined the financial cost of domestic and sexual violence for the state of Vermont. A few states have done something similar. California has done extensive research into the cost of sexual violence, and North Carolina has done the same with domestic violence. With the guidance of their methodology and that of some national work that's been conducted on this subject, we've been able to apply similar research approaches to Vermont to better understand what this violence costs the state each year. Vermont is known to be one of the safest states in the country, and yet violence in our homes and communities continues to be a problem. Despite the toll that domestic and sexual violence take on Vermonters and Vermont communities, we can change things. It doesn't have to be this way. With our strong foundation of caring for each other and our belief in the power of community, we can come together to prevent domestic and sexual violence so that all Vermonters live in safety and peace. We have a violence problem in Vermont, and we can and will do better. In December, the Vermont Network launched the Uplift Vt Campaign to begin the conversation around how to change the culture of violence in our communities. This report highlights the need for this work more than ever before. Violence is costing us too much, both in the tangible public costs we see in this report and in the unseen costs our communities pay every day. We hope that our elected officials will use this report to think strategically about how we can fund violence prevention and how we can better support our communities to end the cycle. So welcome everyone. I want to turn this conversation over to Jessica Barquist. She's our Director of Policy and Organizing, one of the authors of this report, and she'll walk us through the data. Thanks so much. Take it away, Jess.
Hi everyone. Thanks, Karen. So I am going to run through the high-level details of this report, and at the end, I will drop a link to the full report in the chat for you all. And this report was really written in collaboration with a large group of stakeholders, and it represents almost 2 years worth of work. But it should really be viewed as a first step in this process, a start to a larger conversation. And we ran into a number of hurdles trying to calculate costs, either because the data didn't exist or it didn't exist in a way that was accessible. And we were really clear that we wanted to focus this report on the tangible public costs. So the estimates in this report are conservative and leave a number of expenses out. It is likely that we are significantly underrepresenting the true public cost of violence with this report. And I also want to acknowledge that there are an innumerable number of other unseen costs of domestic and sexual violence that are not public expenditures and that are not included in this report. And these costs include things like lost earnings at your job, losses to businesses, the long-term health and mental health consequences of trauma, substance misuse, the loss of life, and so much more. And these costs are real and are paid for by our communities each and every day. So I'm going to share my screen now. Okay. So given all of that I just mentioned, we were still able to find that Vermont spends about $111 million each year publicly funding domestic and sexual violence. We identified that there are 41,829 individuals in Vermont who experience this violence each year. 10,855 of which are children. So this spending breaks down to $2,655 per victim, or approximately $177 per capita. This means that every Vermonter pays at least $177 a year related to domestic and sexual violence. And it's important to note here that all of these costs are calculated using 2018 dollars. And so as you can see on the screen here, we focused our research on the public costs in 5 key areas. And I'll briefly walk you through each of these pieces of the pie. So our first is healthcare. We estimate the approximate healthcare costs of domestic and sexual violence in Vermont to be about $35,931,171. Now, this figure is derived from estimates regarding the total Medicaid expenditures for adult victims of sexual and domestic violence, as well as total state spending on the Vermont Forensic Nursing Program. Our next piece is our victim services. In Vermont, victim services for individuals experiencing domestic and sexual violence are provided by the 15-member organizations of the Vermont Network. These organizations provide support to every town in Vermont and operate 24/7, 365 days a year. The public funding for these critical services includes federal funds, state funding, specialized funding, and housing funding for victims in need of safe and secure housing support. Our total annual public costs for victim services are estimated to be over $12 million. Our third piece is our law enforcement, and the cost projections here are based on wage projections for the time that officers spend on cases related to domestic and sexual violence. Also included in this projection is the full-time trainer position at the Criminal Justice Training Council, which is solely focused on domestic violence. And there are many other public expenditures that could not be calculated in this section, including the many specialized law enforcement positions in the Special Investigation Units, the SIUs, who investigate cases of domestic and sexual violence in our state. And even without that, our total law enforcement costs were calculated at just over $4 million annually. Moving on to our judiciary system, the estimate for the direct cost to the judiciary is just over $1 million annually. And these estimates are based on hours spent by median wages for court workers. These costs do not include any costs related to divorce or parentage cases where domestic or sexual violence could also be a factor. And then our last one is corrections. So we use the most recent DOC Facts and Figures report to obtain the number of individuals serving time for an offense of domestic or sexual violence, and our per capita costs for in-state incarceration. Costs for community supervision are unknown, and so we weren't able to include them. And these figures also don't account for the number of out-of-state offenders. So our total DOC costs for sexual violence is about $33 million and domestic violence, $24 million. So taken together, the annual costs associated with incarceration total over $58 million annually. And there was one additional service area where we were unable to ascertain a cost value. And so it's not included in our final tallies, but we do know anecdotally that the cost to the state is pretty significant. And this is our child protection services. And so using data from the Department for Children and Families, we know that there are on average about 182 substantiated cases of child abuse due to domestic violence and 335 cases of substantiated sexual abuse each year, which totals 715 cases directly resulting from domestic or sexual violence. So DCF was unable to provide us with any estimates for how much the state spends per substantiated case, so we were unable to include that in our final analysis. And throughout the report, we note where data was, let me just stop my screen for a second. Awesome. Okay. So throughout the report, we note where data was unavailable or inconsistent, but this report really highlights the need for better statewide collection and offers a number of recommendations to better understand the scope of state spending as it relates to domestic and sexual violence. And we're hopeful that this data can be the beginning of a new conversation of how we view violence in the state, and that it will be used to inform and drive change to end the violence before it begins. Every Vermonter deserves to live their life free from violence. And I'm going to pass it over now to Amanda Cochran, who is the Executive Director of Umbrella, which is a Vermont Network member organization serving survivors in the Northeast Kingdom.
Thanks, Jessica. Like Jessica said, my name is Amanda Cochran. I'm the Executive Director of Umbrella. Thanks for pulling this together today, and I'm happy to be here to speak on behalf of our member-based programs. Every year, thousands of Vermonters experience sexual or domestic violence. In 2019, Vermonters made almost 19,000 hotline calls to ask for help due to domestic and sexual violence. During the same year, the 15 nonprofit independent member organizations of the Vermont Network, of which Umbrella is one, provided in-person support for over 9,000 individuals. Our organization alone serves approximately 550 survivors each year. Last year, we housed 60 adults and 41 children in our emergency shelter and 6 adults and 8 children within our new transitional housing program. While the rates of those we serve over time vary, the number of people reaching out for help and assistance remains stable with a slight upward trend. Though the prevalence of domestic and sexual violence can be obscured by its often hidden nature, our community members in Vermont are experiencing violence at high rates each and every year. I wanted to offer several challenges faced by victim services organizations like Umbrella. First, victims keep calling our hotline and keep coming in for services that are needed, but our state funding remains stable and has for some time. Staffing costs, costs of living, and healthcare costs rise, but our revenue streams do not. Another challenge we face is related to housing. While we support individuals in crisis and offer emergency housing, securing long-term affordable housing remains a constant challenge faced by victims and those serving them. Lastly, public awareness of the issues. Even after so much progress has been made to educate the community on the prevalence and impact of domestic and sexual violence, so many misconceptions remain and contribute to persisting ineffective approaches. Despite these challenges, this report represents a hopeful vision for our shared future. Its new framing of how we talk about violence in the state will hopefully shift the way we approach the issue as a state, and importantly, bring more people into the conversation. In addition to the data representing the economic impact of violence on our state, this report also attempts to highlight the human toll. These are not just numbers on a spreadsheet, but are our neighbors and their children who are experiencing this harm every single day. I would like to introduce you all now to our last speaker, Annie, whose story is in the report and as an individual who's experienced violence in her life.
Thanks, Amanda. Hi, as Amanda said, I'm Annie. I've lived in Vermont most of my life. This is my home. I've raised my family here and I love Vermont. I am also a survivor. When I was 39, I was sexually assaulted. Afterwards, I spent a lot of time trying to heal, and I looked to the legal system to find justice. But ultimately, the person who hurt me was free to go, but I was not free. And I know that my story is not unique. thousands of Vermonters experience what I did every single year. Even in this small state, this safe state, violence happens every single day. But it doesn't have to be that way. We don't have to accept that violence is inevitable. Being a survivor, trying to stand up and make a difference, make a change, sometimes feels like you are literally screaming into the void. Being silenced is truly soul-crushing. It destroys your spirit. The Uplift campaign gives our voices back to us. It helps us to see that we're not alone. There are thousands of us that are raising our voices together to change the conversation around violence in Vermont. I am so proud to be a part of this report and the Uplift campaign because it's time to do things differently. It's time for all of us to stand up together and raise our voices and be a part of the solution and make a change.
Thank you so much, Annie. Thank you for so generously sharing your thoughts and story. And thank you, Jessica and Amanda, as well. So we want to open up